This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome to the program. I'm Dave Wilson. September is Gynecologic Cancer Awareness Month. That is going to be our topic this morning, so let's introduce our guest, starting with Dr. William McBee, Mon Health Gynecologic Oncologist. Good morning, Dr. McBee.
Good morning. How are you?
I'm doing pretty well, and I believe you've got a couple of guests with you as well this morning. I'll let you do the honors. Can you introduce who's with you today?
Sure. There's two nurse practitioners that work in our group, Jess Pforr and Sarah Proffitt.
Good morning, Jess. Good morning, Sarah.
Morning. Good morning.
Well, thanks to all of you for taking a few minutes before we dive into the topic today. We just would like to get to know you a little bit better, so we'll start with you, Dr. McBee. Tell us a little bit about yourself, your background, and how you ended up with Mon Health.
So I was born and raised in Morgantown. I actually was born at this hospital. I went to undergrad and medical school at WVU, and then did a residency in obstetrics and gynecology at Cleveland Clinic and Metro Health in Cleveland, and then went to McBee at UPMC in Pittsburgh for a gynecologic oncology fellowship, and then I finished that in 2010, and then came back and joined the hospital after I finished fellowship.
Now, you want to talk about coming full circle there, Dr. McBee. You're born at the hospital, now you're working there. That is truly coming around full circle, isn't it?
Yeah, for sure.
How did you choose your specialty?
Gynecologic oncology is a really good mix of surgery and medicine, and not only that, we do an awful lot of surgery. We also do a lot of medicine, so we give patients chemotherapy and also manage other medical conditions. So and the other thing is too, it's the only really cancer specialty that does both. There are medical oncologists treat patients with chemotherapy, surgical oncologists do the surgery part, but not the chemo part. So it's really a pretty unique subspecialty in the fact that we do kind of comprehensive cancer care. Really, the only part of cancer care we don't do is radiation. That's left up to the radiation oncologist, but it's really the only cancer subspecialty that does both surgery and chemo. And so we follow patients for, long term, a lot of times, throughout their entire life. So it's pretty satisfying.
And you are board certified, so what does that mean to the patient?
So it's actually pretty extensive in gynecologic oncology. So I had to pass both an oral and written boards for obstetrics and gynecology. And it's this process. You have to take a test, and you have to collect cases. So take a test for your written board, and you collect cases for a year for your oral boards. And you go to Dallas, Texas, and you sit in front of a group and essentially get grilled and you pass. And then after you do that for obstetrics and gynecology, you have to do the same process for gynecologic oncology. It's the same thing, another written test and then an oral board.
Jess, same question to you. Tell us a little bit about yourself and how you ended up with Mon Health.
I'm also originally from Morgantown, so this is home for me, and I went to undergraduate and grad school at WVU. I started working at Mon Health as a registered nurse for oncology, and then I transitioned over to be a nurse practitioner for GYN oncology just out of grad school. So I've just decided to stay here.
And Sarah, are we 3 for 3 for Morgantown natives here today?
No. I am a West Virginia native, but I'm originally from Point Pleasant, West Virginia.
Okay.
I did do my undergrad at WVU and then my graduate degree in nursing at Wheeling Jesuit University. I also worked at Mon Health as a nurse in critical care and in acute care prior to transitioning to this role.
Well, we are going to get into the subject, Gynecologic Cancer Awareness Month. We'll get into that right after we take this short break. You're listening to Mon Health Talk here on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. William McBee, gynecologic oncologist, Jessica Pforr, Sarah Proffitt, our guests this morning. Mentioned now, September is Gynecologic Cancer Awareness Month. And Dr. McBee, what are some of the most common forms of gynecologic cancer?
The most common type of gynecologic cancer is uterine cancer, and the most common type of uterine cancer is endometrial cancer, which is cancer of the lining of the uterus. The next most common type is ovarian and fallopian tube cancer. We kind of treat them the same. Sometimes those cancers start in the fallopian tube, sometimes in the ovary, but that's the second most common type of cancer, and then cervical cancer, and then vulvar cancer, followed by vaginal cancer in that order.
So what are the most common ways to treat the most common types of cancers that you just mentioned?
Most of the time, the treatment involves surgery first. Not always. Almost always in endometrial cancer, and in most cases, ovarian cancer and cervical cancer. But sometimes the treatment involves chemotherapy first or radiation first. But in most cases, surgery, and then sometimes chemo and or radiation after surgery.
How invasive are the surgeries? So many times on this program, we hear the word surgery or operation, and we think back to, maybe when our parents had to have a procedure done and they were laid up. Well, I'm thinking about back to my parents, maybe laid up for a while. So how invasive are these procedures here in 2021?
Well, they're very different than what you described. Probably over 90% of our surgeries are all minimally invasive. So certainly any type of hysterectomy or hysterectomy with staging for cancers are almost always laparoscopic, minimally invasive. There are a few exceptions where that's really not the right thing to do. And somebody with metastatic disease with ovarian cancer, for example, you really can't treat that patient minimally invasive. You can stage early stage ovarian cancer minimally invasively, but not advanced disease. And with cervical cancers with larger tumors, the standard of care is also doing those through a laparotomy, which is actually it's called a phanestoel incision, which is like a C-section type incision. But there was a large study showing the outcomes for cervical cancer is better through that type of incision as opposed to laparoscopically. So again, over 90% are laparoscopic, but the exceptions are the ones that are essentially better treated through a bigger incision.
Let's bring Jess and Sarah back into the conversation. What are your roles with the patients as they're going through the whole process of being diagnosed and coming up with a treatment plan?
So we're really with the patient through each step as well. We both work in the clinic, and then we assist in surgery as well, and then with follow-up surveillance. So
are you kind of the day-to-day contact, if you will, with the patient for the duration of diagnosis to treatment and so on?
Yeah, for the most part, we're the contact person, especially for those patients on chemotherapy who need symptom management or medications. So we're typically the people that you would call.
What are some of the concerns you hear from patients as they're going through the treatment process?
The most common is, am I going to be sick? And for the most part, we have plenty of medications to treat nausea and vomiting at this point. This is not old school chemo anymore. We have a lot of medications on board. So most patients do very, very well with chemo. There are some chemos that we give that are more toxic than others that have more side effects, but most patients tolerate them very well.
And fortunately, we know in advance with most of them what potential side effects are, so we're able to better prepare the patient and do pre-treatments.
And Dr. McBee, what symptoms should not be overlooked when it comes to gynecologic care?
I mean, I think the most important thing is to just follow up with your gynecologist yearly. Some people believe that, if they're not having any issues or they don't, need birth control, or they get to a certain age, they no longer need to see a gynecologist. So I think the first step is to make sure you follow up with a gynecologist at least yearly. And then in between visits, if you have, for example, the most common type of symptom for endometrial cancer is abnormal bleeding. So any postmenopausal bleeding, or even if you're premenopausal and your bleeding is not normal, if you're not having, normal cyclic monthly periods, if it's anything between periods or your periods are very, very heavy, that would be a reason to see your gynecologist usually first. And then usually the symptoms for ovarian cancer are, fullness in the abdomen, or you feel like, you can't eat as much as you used to, or you eat a little bit and you get full, or nausea, vomiting. Those are usually the presenting symptoms for a mass in your abdomen, or or unfortunately sometimes with metastatic ovarian cancer. And then the other types of cancers we talked about, cervical, vulvar, and vaginal, are really cancers that can be screened for and caught very early if you do see a provider on a yearly basis.
Our guests this morning, Dr. William McBee and nurses Jess Pforr and Sarah Proffitt. We are talking about Gynecologic Oncology and Gynecologic Cancer Awareness Month. We'll continue that conversation on the other side of this timeout. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guests this morning, Dr. William McBee, gynecologic oncologist, Jessica Pforr, and Sarah Proffitt, nurses, joining us as well. Are there non-surgical treatment options available for different types of diagnoses?
Yeah, there are. I mean, most in gynecologic oncology, most of the treatments involve surgery, but there are non-surgical options. It really depends on the type of cancer we're talking about, and quite honestly, a lot of the non-surgical options are inferior to the ones that involve surgery. For example, with endometrial cancer, you may be able to, in most cases, we cure endometrial cancer with surgery. So as opposed to, you could treat those with radiation, but maybe your cure rates go from 90-some% down to 60 or 70%. So there are non-surgical options, but for example, in ovarian cancer, you could treat somebody with chemotherapy only, but in most cases, better outcomes are one that involves both surgery and chemo.
Is genetic testing available for patients who may want to know more about their risks?
Yes, genetic testing is available for most of the patients who have cancer here. Ovarian cancers have a genetic link. About 20% of those ovarian cancers are genetically related. And then for about 2 to 5% of endometrial cancers are genetically related. So patients who have that history, we do get them in, we evaluate them. Typically, we can get patients in for genetic testing within 2 to 3 weeks if they want to. You can push it out more if they want to do that. But and that's also part of their cancer care. So when we're planning for chemotherapy or radiation, that's part of their workup, is making sure that they've gotten genetic testing as well.
Is pregnancy still a possibility when we're talking about gynecologic cancer?
It is. In most cases, when you talk about younger women, pregnancy-age women being affected with gynecologic cancers, it's usually an ovarian cancer, a type of ovarian cancer that we can definitely manage conservatively. You could take out the one ovary but still leave the uterus and the other ovary. So, and even in endometrial cancers that affect young women, there are definitely surgical options, and certainly, there are definitely pregnancy options after surgery or medical treatment in that case that wouldn't involve surgery. And then certainly in cervical cancer, which is probably the most common type of cancer that affects reproductive age women, pregnancy is definitely an option after treatment.
We talked a little bit earlier about some of the side effects and some of the concerns patients have as they're going through treatment, but are there other side effects patients need to be aware of when they go into this? There
are surgical side effects, so we talk about, post-operative recovery if the patient undergoes surgery. If the patient needs radiation, there are specific side effects that may be involved with radiation, which both we talk to the patient about as well as the radiation oncologist. Dr. Littles is a radiation oncologist here at Mon Health and does a fabulous job with patients. So I know he counsels patients very extensively, as do we. And as Sarah mentioned earlier, there's specific side effects that are kind of chemotherapy dependent, depending on which type of chemotherapy they're needing. And we go through all those with the patient.
So when should a patient come see you? When will a patient make an appointment?
Most of our patients come see us through a referral by their gynecologist usually, or their medical doctor, their family doctor, or their internist. But certainly patients, we're happy to see patients directly if they have a concern or, they have a cancer diagnosis and they want to transition, to care, or if they're just, concerned and want to see us directly and not go to somebody else first. We're happy to see a patient today at any point.
Is there anything you can do if you've got a family history of gynecologic cancer, or you've gone through the genetic testing and there are, the possibilities are there. Is there anything you can do to reduce your risk or prevent it, or is it just a matter of monitoring for some of these early warning signs?
No, there are prophylactic surgeries available for patients with higher risk of certain types of cancer. Patients with higher risk of ovarian cancers due to family history that aren't genetically related are candidates to have their ovaries removed once they're done childbearing. And that changes, depending on the patient's what the patient wants, of course. But yeah, there are options available.
There's also non-surgical options too. For example, if you have somebody who is at risk of ovarian cancer, you can start them on birth control pills, which will reduce their risk of ovarian cancer. So there, like Jess mentioned, there are surgical options for risk reduction, but also non-surgical options.
And to kind of bring it back around to one of the very first points you made, Dr. McBee, the importance of that yearly exam and that yearly checkup, so you can catch something if it does arise in the early stages. Early is always easier to treat, isn't it?
Yeah, for sure.
Where can people get more information, learn more about you, or make an appointment if necessary?
So the office phone number is 304-285-3870. We're very, very efficient about getting patients in within the week. So we never make patients wait to come in and see us. And then if the patients need surgery or other treatments, we always initiate those within 2 to 3 weeks at the longest. I mean, so we have a very efficient system at Mon Health. We can get patients in both to the clinic and then the OR if they need, very quickly. So also on Mon Health's website, there's information about the practice and about all the three of the providers. So that's how patients could get more information.
You can go to the website, monhealth.com/cancer. Of course, always more info over at the Mon Health Facebook page as well. Dr. William McBee, Jessica Pforr, Sarah Proffitt. Guys, thanks so much for spending some time with us on a Monday morning. I appreciate it.
Thank you.
Thank you.
Coming up, it is the top of the hour. We'll get your Fox News local news and AccuWeather updates. Then it's time for Talk of the Town right here on the voice of Morgantown, WAJR.
This is 104.5 FM and 1440 AM WAJR Morgantown, a West Virginia radio.